Kisi, and I'm here at Chandler's Holistic Health Services talking with Miss Dorothy Chandler. We're going to be talking today about hydrocolon and get a little bit of information and education on as to why that is important. And this is Miss Dorothy Chandler. Why don't you tell us a little bit about yourself and a little bit about Chandler's Holistic Health Services?
Well, first of all, I'd like to thank you, Kisi, for coming today and for taking the time to learn more about colon hydrotherapy. I'm an Illinois licensed registered nurse. I have been for now a little bit over 40 years. I worked as a nurse in all areas of healthcare, whether it was women's health or med-surg or operating room or emergency room, home health. Pediatrics, I've kind of seen and done, just about everything that there is to do for nurses within that industry. Early on in my nursing career is I worked on a surgical unit where we prepared people for the operating room and specifically for surgery on their intestinal tract, or their surgery on their colons or their small intestine. And one of the things we did that I was assigned to do was give enemas to clear. Okay, so imagine during an 8-hour shift that I would take the patient into the bathroom and I was infusing water from an enema bag, which is about a quart or a little bit of more than a quart of water, into the colon, and we did this repeatedly over and over and over again through that 8 hours until the water that was coming out of them was clear. So kind of, when I stopped to educate myself, I said, Dorothy, that's a colonic, right? That's a colon hydrotherapy session. If the water comes out clear at the end, look how much time it took me in that 8-hour shift and how many times I had to work with that patient in order to get that result. And with a colon therapy session, I could do it in a much quicker way. Mm-hmm. Right? And so that was one of the education pieces of my retraining my way of thinking about this holistic modality and its use for people. Chandler's Holistic Health Services is a holistic health practice that provides both naturopathic manipulation and body work. My husband, who I'm in partnership with, Dr. Milton Chandler, is an Illinois licensed naturopath, and we also provide colon hydrotherapy, occasionally nutritional therapy as well. We want to help educate our clients. We do a lot of that, where we, will play movies or have discussion groups regarding and taking responsibility for your health and taking control of every portion of your health and your nutritional status. The body gets rid of waste material in 4 ways. One of them is when we're exhaling. All right, so there's really a lot of emphasis on deep breathing and really taking the time to do that, because most of us breathe shallowly. We're not conscious of taking a really, really good deep breath and then letting that carbon dioxide and those other gases out. The other way the body gets rid of waste material is when we urinate. Mm-hmm. So when you consume large amounts of water, minimally 8-ounce glasses a day, but more than that if you can, then you are doing a proper flush of your kidneys, because your body is processing waste through the liver, and some of it is going to come out in the form of urine. Mm-hmm. The other way we get rid of waste is obviously when we move our bowels. Right? And so many times people are not going to the bathroom on a daily basis, and so they have a little bit of accumulation of waste material within their colon structure. We train and use 2 different types of systems. One's considered the closed system and one's considered the open. I'd like to show part of the closed system. This is a obturator or speculum that is used to introduce this portion of the tube into the colon. It only is going in 2 to 3 inches, okay, because the rectum itself is only about 7 inches in length. So it's only going in about 2 to 3 inches. This bulbous piece that you see here is designed to make it a smooth entry. The tissue inside the rectum is just about as similar as to the tissue in your mouth, you know, along your cheek. And so if you don't have something smooth and lubricated, it could easily irritate it. And so this is designed so that it doesn't go in, so that any sharp edges are felt or anything like that. It goes in with what we call an introducer or an obturator. And then once it's inside the client, this is taken out by the therapist. And so this doesn't go in again until the end, when you are reintroducing it to remove the tube from the client, to make it a clean and easy removal. What's attached also here is water, so that water can go into the client. And then there's a waste hose that you'll see here that gets attached. You can see it's all disposable. This is one of the types of speculum packs that are available for therapists. And it gets attached here and then attached to the unit. Okay, one's attached to the unit and one's attached to the tube here with the client. And so the waste material is actually going out through a designed waste exit line for removal of the waste. The client doesn't have to come in contact with the waste at all. Okay, and the therapist is actually operating when water goes in and when the waste and water comes out. The therapist is in complete control of that session. So on the other hand, we have what would be considered the open system. And so the open system basically means, to me, the way I equated it, is more similar to an enema in a way. Even though the client is not getting up from the table. And so this is one of the types of open system tubes that's used. The very beginning of the tube, the first couple of inches, is what's actually inside of the client. The clients do self-insert, and they are encouraged to self-insert both tubes. And when we do our training with our students, we are teaching our clients to self-insert the tubes. That's one of the ways that our manufacturers are encouraging us to do. You're laying on your back for this one. The tube tilts upward to follow the exact pattern or path of the rectum. It's a soft tip tube, you know, so that it's easy on the mucosa. To me, it sometimes reminds me of what I used to use when I was suctioning out the oral cavity in my nursing training, Yankauer suction. It kind of reminds me of that. And Yankauer suctions have a soft tip, and that's where they're used for the mouth, and many times used in the abdominal cavity, wherever they need to have a soft tip. So the first couple of inches of this tube goes into the rectum, and it is placed by the client under instruction from the therapist. There's another plastic piece that's considered a flex tubing that's attached, and then they both are attached up to the water inlet from the device, from the open system device. And filtered water goes in, and both units use filtered water. Okay, that goes in. No faucet water is going into the client. So water goes in, and then the client is able to release when they feel the pressure build up, as if they need to go to the bathroom, that peristaltic action. They're able to release into a basin that's built into the table. And so the open systems are designed to remove odor. They're designed to remove any kind of gases that might be being released, and what the clients are able to see is that water is coming out. They can actually see the waste material that they're releasing come out on both systems. So with the closed system, you're not releasing. The therapist is in control of putting the water in and letting the waste and the water out. With the open system, it's more under the client's control. We regulate the water flow going in, but the client decides when they want to release. Okay, and so both are done with appropriate pressures of water. You can't overfill the client. They're done under, the water is temperature regulated, and so properly trained therapists understand that you need to keep the water at certain temperatures so that you don't cause any undue harm to the colon, providing water that might be too hot or water that might be too cold. The therapist is present for the session. With the open system, therapists are able to leave the room and come back in, but for the most time, most therapists stay with the client. They don't just walk off and, let you just, have your 45 minutes to your hour of meditation time all by yourself. Many times we're engaged in all types of conversation and doing other types of therapeutic techniques during the session.
What would you say to people who may be skeptical about trying a colonic treatment? And also doctors who may discourage their patients from getting this type of service done.
Well, Akisi, as I referenced earlier, one of the things that I found very valuable in becoming a colon hydrotherapist is I was able to kind of use my practical nursing experience of understanding that what I was doing when I gave enemas to clear, I was actually providing a colonic, but just in little short stages. Because it was introducing water into the colon for the purpose of loosening up the contents in there, getting the waste out so that they can be evacuated. And that's what a colon hydrotherapy session is water into the colon, okay, in and out several times or many times during the session for the purpose of loosening the waste material and then having the normal peristaltic action of the bowel of the large intestine to release it. That's how it's done. Any of the units that are FDA registered, there's no vacuum attached to that, so there's no suction. There's none of that. It's actually the colon. And so kind of think about it like this. The way the colon operates is that it has normal function that we call, one of the ways it works is called mass peristalsis. And in mass peristalsis, you have a strong urge to move your bowels. Right? And usually for some of us, that will happen 2 or 3 times a day after a meal. That is some of the action, that kind of urgency that takes place during a colon therapy session. Water goes in, right? The bowel reacts to that, your muscle tone starts to react to that, and then it's actually the peristalsis that moves the waste and the water out. The colon, and you got a picture here of the colon. The colon or large intestine is an organ that's at least the length of your body. So by most textbooks, it's at least 5 feet. And so, you never know what's going on inside somebody's abdomen. So as a colon therapist, I can't look at you and say your colon is this or that, but I can say to you that most textbooks will say it's about 5 feet.
Wow.
Typically it's about 2 to maybe 2.5 inches wide. Now, can some people have wider colons than that? Again, yes. When you look at the colon, you look at that it's, going from one side of the body to the other, so it kind of crosses the abdomen. It becomes the rectum, okay? It is very thick. And one of the ways I, like to always help my clients understand, I always say, are you familiar with chitlins? Most people will say, Dorothy, no, I don't. Well, I would say go to Moo and Oink, or go to one of those stores where they have loose guts, pig guts, that's what they're called, chitlins, and you'll be able to see what the intestine looks like. I think it's important for everybody to have a visual of that so that you get a chance to see what the small intestine and get a chance to see what the colon actually looks like. And I think, if we refer back to Dr. Oz, one of the things that I've appreciated that he's done is actually show visuals and actually have participants on his show get up and actually handle those organs with gloves on. And you get a chance to see that it's, it's kind of a muscle tissue. It's not very thin. It's a pretty thick muscle. And that would be in a normal condition. Again, if somebody has a disease process or some kind of pathology, we wouldn't know that. And so that's why it's important to be properly trained so that you might pick up other indicators that would indicate who can be seen and who shouldn't be seen, and who to send to the medical doctor, who to get a prescription on.